Severe mental illnesses, such as psychosis, both affect and are affected by a great many things. Some of these are best treated with medication and hospitalization, but it's clear that for people with psychosis to have the best chance of a full, happy, and symptom-free life, we need to improve on the traditional model by adding psychosocial interventions into our offer of care. In lower and middle-income countries, however, asking care providers to do more when they are already struggling to keep up with demand isn't easy. In 2017, the European Commission funded Impulse, a study designed to show how we can use existing resources to treat people more holistically, giving them better outcomes and eventually reducing demand. We started by implementing DIALOG Plus, a psychosocial intervention that can be delivered with only 3 hours of staff training. It uses a simple set of questions that allow service users to voice their wider concerns and be supported to find solutions. Our research shows that after only 4 sessions, the DIALOG Plus intervention significantly improves patients' quality of life. We have also shown that it is easy to implement and adhere to, acceptable to staff and service users, safe, and due to its generic nature, can be easily scaled up. The intervention adds just 8 minutes to pre-existing routine clinical appointments. Aside from our own clinical research, we also provided more than 100 hours of training to research staff, which we hope will contribute to the creation of many future mental health research leaders. To make sure our research is meaningful and sustainable, we worked collaboratively with all the relevant stakeholders throughout the project. We worked hard to ensure good communication between them and hosted events and workshops in local communities, as well as webinars and conferences on social media. These conversations revealed a lot of uncertainty about how things might work in practice, but also a huge appetite for change. It wasn't just clinicians who needed to understand the whole person model. For service users and their families, after years of being passive recipients, it took time for them to gain enough confidence and to feel empowered enough to start taking an active role and asking for a different kind of help. Mental illness means many different things to different people. Unfortunately, it often means a shorter life expectancy, higher chances of poor physical health, and lower chances of getting medical help when it's needed. But it doesn't have to be like this. The Impulse study has shown that a better way is possible. But to do this, we need your help. We need you to learn from what we've done and to build on it, to do what you can in your country, your team, and your unit today, so that together we can provide better care and produce better outcomes for everyone.